Today I have Michelle with me, and she is a patient of mine who is about to undertake what we call orthognathic or jaw surgery. So the purpose of the video today is so that I can explain to patients why they need jaw surgery and what's actually involved, right? Now, if we take a step back, Michelle was referred to my practice because she has a bad bite, what we call class 2. Class 2 simply means that the upper jaw and the lower jaw don't match, and normally it's because the lower jaw is too far back, which is the case for Michelle. The main symptom Michelle's had is jaw pain, and that's a common symptom because if you look at where the lower jaw should meet the upper jaw, if they meet in the correct position, then this jaw is not loaded. But if the lower jaw is too far back, then obviously this is under pressure. So she's had some conservative treatment with a prosthodontist for the jaw joint, but the moment she doesn't wear her plate, of course the jaw drops back. So short-term relief for the TMJ is certainly some physical therapy and splint, but long-term treatment is movement of the jaw. What that entails, here is the current x-ray, and you can see there's a 9mm discrepancy between the upper and lower teeth. And this is why I say to patients, if you're young and your jaw is growing, you can actually have the lower jaw move forward with growth. But when you're an adult, unfortunately, we can't do conservative, what we call dentofacial orthopedics, such as a bioblock or a twin block or a Mara. So for an adult, we need to actually physically move the jaw. So moving the jaw involves a maxillofacial surgeon for the surgery and an orthodontist to get the teeth corrected. Because if the teeth are not in the right position, when the jaws move forward, the patient won't be able to get their teeth together. So as a result, they'll go back to biting in their old fat way, and that could cause the surgery to be unsuccessful. So normally, an orthodontist would get the teeth ready, and you can see right now in Michelle's case, can you smile, Michelle? Her teeth are nice and straight, but you can see the gap between the upper and lower jaw. So what would happen is we would be moving the lower jaw, in Michelle's case, to match the upper jaw, and that will take pressure off her jaw joint, also give her a better profile, but most importantly, it will give her much better airway, because when the lower jaw's back so far, the tongue is pretty much occluding the back of the throat. So let me show you a few things here. And this jaw, again, is called class 2. Class 2 means that the lower jaw is well behind the upper jaw. And we want to change that class 2 into a class 1. If I look at it as a graphic representation, this young lady, same lower jaw problem, and then the lower jaw is advanced forward, and I'm going to explain how that advancement occurs. But you can see the vast difference in the profile, and people always get confused what is jaw surgery. So if I talk about the lower jaw, it's not cutting the jaw. Cutting the jaw would be almost, or breaking the jaw would be, if I get the jaw in my hand and I break it into 2 pieces, that's breaking the jaw. We don't break the jaw when we do orthognathic surgery. We do a controlled cut. So if you come closer here, you can see the cut is done internally. So that's the cheek, and there's not going to be any facial scarring. When the cut is done internally, the 2 parts of the lower jaw are always held together as you advance them. So I explain to patients, imagine you're having a Tim Tam biscuit. The Tim Tam biscuit is in layers. If you cut that Tim Tam in the middle, and then you slide one part of the Tim Tam over the other, the Tim Tam's still together, but you have now a longer Tim Tam. So in the same way, with your jaw, at no stage are the 2 bits of jaw separated. They're always held together, and a small titanium screw is placed to hold the jaw together, and the bone heals. Once the bone heals, then the jaw is stable. And that could take a 3-month healing period. People ask, is the jaw going to be not as strong after the surgery? We do this same surgery for football players who play first grade rugby league or rugby union. They break their jaw. We have to put it back in the right position, and then they go back to playing football after everything heals, and the jaw is just as strong as it was beforehand. The second question people ask, will that little titanium screw cause metal detectors to go off at the airport? The answer is no, because it's made of titanium, and secondly, it's very small. Third question people ask, after my jaw surgery and the bone's healed, can I get those screws and plates out? There's no need to take them out because they're inert, and it just means a needless second operation. In some countries like America, they're very big on doing 2 surgeries because of insurance. The insurance will pay half the money for the first surgery and the second half of the money to remove the plates. But here in Australia, there is no need to do a second stage surgery. So I gave you a little bit of an overview of what jaw surgery is. What we're going to do now in the second part of this video is maybe ask the patients some questions. Okay. So Michelle, before you came to see me, do you want to describe what sort of symptoms you were having?
Yes, so when I first came to see you, you know that my jaw was onto one side.
Yep.
Yes, so I wasn't able to open my bite.
Uh-huh.
Yes, so I had really bad facial pain on one side.
Yep.
Some wear on my teeth due to the clenching of the jaw not being aligned.
Mm-hmm.
I bite onto my cheeks inside and onto my tongue often. Also difficulty breathing at night, difficulty speaking, and swallowing is a big one too. I cannot even swallow tablets. Yeah, so it is affecting me a lot. Yeah.
Now, you mentioned the point of being hard to swallow, and I'll just explain what that is for our audience. When I look in your mouth, what I'm seeing is your tongue is on the back of your throat. So there's very little opening. So that means particularly at night when you fall asleep and you lie on your back, that drops even further. After the surgery, you'll have a much better opening, right? A, for breathing, which is good for sleep. B, as you said, so when you swallow, you don't feel like you're gagging all the time, right? During the first part of our treatment, while I'm straightening your teeth, I sent you to my prosthodontist. Do you want to describe how that felt and if you got relief and what was involved in that?
Yeah, actually, I went to a few appointments with the prosthodontist. He was honestly amazing. You know, he gave me some short-term relief, but after a couple of months, it came to a realization I can't keep going to him for the rest of my life. There has to be a solution. Yeah,
and that's an important point. We want to relieve the patient of pain early, and this prosthodontist, he's lovely, and I've worked with him for 40 years, right? But he's very against surgery, right? And I know he tried to talk you out of surgery many times, and that's fine because in his world, it's all about irreversible treatment.
It's probably like possible he maybe could have pushed it forward, but then I felt like it was straining a lot on my muscle, on my face, on the side.
And then the maxillofacial surgeon that we're working with can also give short-term relief with what's called an arthrocentesis, which is an irrigation of the jaw joint. But again, whether you have a splint or irrigation, it's not long-term benefit. A long-term benefit is get the structure back to normal, and we have the saying form and function. When the form is good and the function returns to normal, that will also help. So many people listening to this podcast will want to know, why you have chosen to go with the jaw surgery.
Well, there's a couple of reasons why I have chosen to go along and do the jaw surgery. At first, I was so scared.
And to be honest with you, if anyone comes to me and is not scared about jaw surgery, they're not normal people, because surgery anywhere is bad enough, but when you talk about your face, it's a very personal thing, it's highly innovated, etc., etc. So I'm always worried when I have someone who's come in and had 3 surgeries on their jaw and wants another one. We have a saying, some people could have what's called body dysmorphobia, where really they're never going to be happy with their face, right? So I'm pleased when someone is nervous, because that is a normal response. And my job, and that of the max-fac surgeon, is to educate a patient what surgery is, because they've heard all these bad stories, or they've Googled the wrong thing, etc. But surgery, particularly in the modern era, is very well planned, and the instruments we use, such as there's no more chisels or cutting the jaw, we use a gentle force, which is called piezo, and that piezo means that the healing of the bone is quick and easy. And we'll talk a little bit, because we're going to talk you through what to expect post-surgery, etc.
Yeah.
What's been your experience with the braces getting ready for the surgery?
And to be honest with you, if anyone comes to me and is not scared about jaw surgery, they're not normal people, because surgery anywhere is bad enough, but when you talk about your face, it's a very personal thing, it's highly innovated, etc., etc. So I'm always worried when I have someone who's come in and had 3 surgeries on their jaw and wants another one. We have a saying, some people could have what's called body dysmorphobia, where really they're never going to be happy with their face, right? So I'm pleased when someone is nervous, because that is a normal response. And my job, and that of the max-fac surgeon, is to educate a patient what surgery is, because they've heard all these bad stories, or they've Googled the wrong thing, etc. But surgery, particularly in the modern era, is very well planned, and the instruments we use, such as there's no more chisels or cutting the jaw, we use a gentle force, which is called piezo, and that piezo means that the healing of the bone is quick and easy. And we'll talk a little bit, because we're going to talk you through what to expect post-surgery, etc. What's been your experience with the braces getting ready for the surgery?
Honestly, the best thing I have chosen to do was put the braces. You know, before even coming here, I've seen multiple other orthodontists. They've quoted me 7 years to wear my braces. And they've never mentioned the surgery to me. One did, but mentioned that I have to remove 2 healthy teeth at the back. I was considering it, but then after pushing it for 1 year, I said, you know what, no, I have to accept it. I need to do the surgery, because it's not just about how I look or where my teeth are placed. It's like I've said previously with the other issues, there's more issues.
Yes, exactly. And I draw the attention to why some orthodontists were suggesting taking out teeth and pulling the front ones back. So what you've got to understand, that might improve the bite, so the 9 millimeters may go back to 2 millimeters, but what it will do, it will keep the lower jaw in the wrong position, so you still have the jaw problems, the breathing problems, the swallowing problems, but it'll age your face, right? So I just want to show you an example, and anyone can Google this. If you Google twin study in orthodontics, you'll see a number of patients. Here's one set. They are identical twins, and they have the same class 2 jaw, right? But if you look at their end of treatment result, you can clearly see who's had the teeth pulled back and still will have the jaw problem. Probably the jaw problems will worsen now because of that, as opposed to the girl who's had the jaw brought forward. So definitely and as I said, there's many twins that you can compare the difference between moving the jaw forward or pulling the front teeth back. And that's a very, very important point. Pulling the front teeth back is what we call dental camouflage. So you're not really fixing the problem, but you're camouflaging it. So when you have a class 2 jaw, there are 3 options. Ideal option, when your child is young and growing, we use orthopedic appliances and we stimulate growth of the jaw so it catches up to where it should be. Nice conservative treatment, no surgery, possibly involving braces later. But if you're an adult, there's only 2 choices. There's camouflage, which we just described, and there's to fix the real problem. To me, it's all about fixing the cause of the symptoms, not just masking the symptoms. And I've had many patients who've gone along the track of saying, great, I've avoided surgery, I've sacrificed 2 teeth, and then they're very unhappy because they look older, they've still got jaw pain, and of course their breathing hasn't improved.
So can I also say something? Back when I was younger, I did not know, my parents did not know about the prevention of having jaw surgery as an adult. And now I'm becoming a mother myself now, and my son has just turned 8 years old.
Right.
I've decided to book an appointment with you.
Right, great.
Because I want to do like, what's the word, early intervention?
Early intervention, yeah. Which
yes,
is what
so I can pinpoint when he's at a young age. So learning based off my experiences.
Yes, exactly.
I can, do it with my children.
Great, and we're very appreciative that you're doing this video, because you're a perfect example of someone who didn't have early treatment, was then offered probably the incorrect treatment, and now has made the right decision. Obviously, we'd love to follow up this video after your surgery, because anyone who watches this, and who knows, this might have 1 billion views if we do this properly. You'll be a celebrity. If after people watch this and they learn so much, the next thing they'll want to know is what happened to that girl. So we'll follow up Michelle post-surgery. And now let's talk about post-surgery, okay? People are always worried what to expect, right? So the first thing is we no longer wire the jaws together, right? That's the old way of doing things. So in the past, when someone woke up out of surgery, they actually had their jaws wired together, and they couldn't talk, they couldn't really eat, they had to have everything through a straw. And the biggest worry was that if they couldn't breathe through their nose because they had a deviated septum or lots of allergies, it was almost impossible for them to actually function. You imagine you can't breathe here and your jaws are wired together. It's a very frightening feeling. And now the patient is encouraged to go back to normal function. So we've given some elastics for you to wear. So you'll have your braces on, and we'll have rubber bands that you can take on and off while the bone heals, right? Now, you definitely will lose weight, right? And the reason is because you've got soft food for probably that first 4 to 6 weeks, depending. We work with a nutritionist who will tell you, what foods you should be blending so that you keep, still a good diet. But particularly with those football players, they're used to having 3 or 4 steaks every day, and they find it tough because they're on a soft diet. Once this bone is healed and we release the elastic, we actually want you to return back to normal function, and then you'll feel more strength in your bite. So the risk as we get older and we stretch nerves is that the nerve takes longer to repair. So you're at the perfect age because you're young and you'll have very good recovery. But if I see someone who's 45, 50, 55, 60, the risk is that the bone takes longer to heal, but the nerve supply, because you're stretching this nerve, takes a lot longer to heal. So some of those patients may end up with what's called paresthesia, where they, particularly on the lower lip, they have a numbness or a tingling. So when they're eating something, they can't feel that, and it can be dangerous if they have something hot because they could burn their lip without feeling it. But as I said, these are the risks that people go through. But in the newer surgeries, because the cut is planned, and it's planned using 3D technology, did the maxillofacial surgeon show you the planning of your case?
Not yet, next month hopefully.
So this is how we plan your surgery, okay? So on the day of surgery, it's not as though the surgeon guesses where to move your jaw or where to place the cut. Everything is planned using computer technology and specifically what we call a CBCT. So what will happen, we know where the teeth are because I've moved them into that predetermined position, and then the surgeon knows where to place his cut, and then the fixation screws that I was talking about have already been manufactured. So after the cut, he places those in the exact spot where they were designed. So that's why we reduce the injury to the nerve, because we're planning and we know exactly where the nerve is located, so we're cutting away from that nerve. So this is what we call a pro plan, right? Now, when we sat down and we discussed the movement of your treatment, we were using another software, and this is called Morphus. So Morphus, again, 3D, means that we have taken your face, we've scanned it over the 3D x-ray, and the computer, using AI technology, is able to predict ideally where would be the best facial balance. We also look at the airway to determine what would give you that best opening. So a lot of planning goes into a surgical case. So that's why when people are planning to have surgery, they don't understand that they'd have to have braces before the surgery. Some people, their teeth are already straight. And in those people, we could do what's called surgery first. But that's the rarity. This is more the norm. Planning the treatment, moving the teeth into the right position, and then moving the jaw. So very planned procedures. So Michelle, thanks for coming and shooting this video. You'll be helping millions of people around the world to make the right decision, and also I think a lot of people will be following your journey, right? Do you have any other questions for me?
So I think you've covered pretty much everything, and I feel like I even learned a bit more sitting here with you today.
Great. Well, we look forward to following Michelle's journey post-surgery. We'll go through that. You won't be the happiest person at that time, right? But already we'll be able to see the difference in your bite. And then once everything's healed and you're back to normal, it'll be very good for us to monitor not just the facial aesthetics, but your breathing and all the symptoms you've had, particularly your jaw joint. So thanks again for coming in, and
thank you for having me.
And we'll keep you posted.